So let's talk about one of the biggest topics, dementia. Dementia, cognitive decline, memory loss, all of those fall into that category. Why is it so important to talk about dementia? Because that's the first thing that comes to mind for anyone who has a little bit of change in their memory. As we're getting older, we tend to forget things. We're having to write things down. And right off the bat, we think we're developing Alzheimer's dementia. But what we forget, or what we don't know about, is that there's multiple types of dementia, and that's what I wanted to talk about today. So yes, 60 to 80% of memory loss and cognitive or mental status changes are secondary to Alzheimer's dementia, but there's other dementias as well that take up that other 30 to 40%. The most common is age-related dementia, which of course is when we get much older in our elderly, which are simple things that we tend to forget, which is natural. But what's the most scarier part is the Alzheimer's dementia. Now, what is Alzheimer's dementia? It's caused by these abnormal proteins that are deposited in the brain, in the nerve tissue, that cause a change in memory function, your ability to communicate, your ability to remember things, personality changes, and when in severe stages, you tend to forget even how to eat or coordinate your hands and fingers, and sometimes you're bedridden. It usually happens in the much elderly, but there are multiple cases. There's something called early onset Alzheimer's, which we tend to see in 50s and 60s. If you do have memory changes, and especially if you're forgetting things in odd places, if you're driving and suddenly forget directions, if you forget names of your families and you start noticing those changes, or if you're a family member and you see your loved ones having those changes, definitely please let their doctors know. The other most common thing in Alzheimer's is also initial changes of mood and behaviors. We know well that sometimes our parents get very cranky, or we have mood changes, we have anxiety, depression. We often say, oh, it's just that, we're getting old. But do talk about these things with your doctor when you go have your appointment. The other kinds of dementia are vascular dementia. I'll explain each one of them. But vascular dementia, Lewy body dementia, there's frontotemporal dementia, and mixed dementia. What is vascular dementia? That's when there is poor blood flow. There's multiple mini strokes over your lifetime that causes a decrease in the amount of brain tissue, so that causes memory changes. Usually that's related to simple things, forgetting how to do things, forgetting numbers, forgetting language skills. Now, sometimes with vascular dementia, also, there's a rapid change in your functionality. What is Lewy body dementia? Some people mistake it for Parkinson's disease. Usually Lewy body dementia starts more with mood changes and movement changes. You have tremors, you have, mood changes, get more, agitated, get more depressed, and then suddenly there is a change in your memory. And there's much more drastic changes in memory with a huge step down with every time you notice, every few months, and it's associated also with increased amount of falls, difficulty swallowing, things very similar to Parkinson's. Frontotemporal dementia, very interesting dementia it is, because it affects the frontal part of the brain, which is the front part of the brain that actually controls your emotions. So a lot of times, patients with frontotemporal dementia usually have mostly mood changes. They have anxiety, depression, being very agitated, throwing tantrums, aggressiveness, overeating. They have this tendency to overeat and to binge eat, and or also to have increased sexual desire. And all of these can be chalked out to, oh, they're just getting old, or they're weird, or they're cranky. But you have to keep track of this, because the memory loss in terms of their communication skills and their ability to remember certain things comes on much later in frontotemporal dementia. And then again, you have mixed dementia, which can be a combination of all of these. Where do you start when you feel like you're having memory changes? Talk to your doctor, write down a journal of all the changes that you're noticing. And if this is your parent or your other loved ones, please help and maintain a diary of, the symptoms so you could talk to your doctor at every visit. There are some blood tests first we want to do that cause memory changes, like thyroid, like vitamin B12, folic acid, even RPR, what is RPR? People with a history of syphilis that was not treated, or you didn't know that you had syphilis. It can lead to neurosyphilis as well. We do HIV because there is associated dementia or memory loss with HIV. A history of trauma in the past, right? So these are all the basic labs we will do. Second thing is, if we do consider dementia, that there is true memory loss, we can do an MRI of the brain, look at the brain tissue itself. The simple tests that your primary care doctor can do in the office, such as mini mental exam. It's a test that is quick 30 questions, and we label it, we score it, and then we say, yeah, maybe not. But then there's one person or one physician that you can go to that really helps, is a neuropsychologist or a neuropsychiatrist. They actually do more extensive testing that helps determine if you do have memory loss, what type of memory loss, what degree of memory loss. I have had some patients, as they get older, their learning capability goes down. And it's not just remembering, but because of their learning capability, their language barriers, underlying anxiety, underlying depression, all mask, all can show up as memory loss. And it's very critical before we start labeling somebody as having dementia or treating it as dementia, that we rule out all these other causes. And that's what a neuropsychologist or a neuropsychiatrist will do. There are different medications for dementia these days, ones which slow the progression. And some there are that are just released, you must have heard, with FDA, that are proven. These are IV drugs that have shown that it does help slow the progression, especially when given in early stages of dementia. But there is also data, as so far, that doesn't prove or show that there is a tremendous benefit in completely reversing the dementia. If you have any other questions regarding this, please talk to your doctor so that they can do the appropriate testing at the right time, whether that be a neurologist, your psychiatrist, your primary care physician. Do bring it up. Now, one last thing I would always like to let people know is caregivers. It's very important as a caregiver for a loved one with memory loss or dementia. We have to remember that patience is the key. It takes a lot out of us as caregivers to take care of the elderly or anyone in our home with dementia, because there's so many. Each day is very different. And don't forget to take care of yourself, but also make sure that you're always there for their doctor's appointments, because that's the best way as physicians that we rely on your information of how the patient is doing on a daily basis. That helps determine how we treat them.